welcome. It's wonderful to have you. And if you could share a little bit about your background with our followers and our listeners. I know you're a naturopath.
Yes.
It's
So,
published, which is exciting.
yeah, so thanks for having me on today. I'm a naturopathic doctor and I was trained technically as a naturopathic obstetrician was the actual coursework, but I worked as a midwife. And so I did lots of home births and some birth center births, and sometimes would have to transport some women, so we would end up in the hospital. But it was really wonderful and really beautiful to work with women this way. And so then I've worked with women and women's health and also with children. And so I've been doing that for the last, over 20 years at this point. So it's been great. And, it was really interesting to see how interest in natural medicine has really flourished in the last 2 decades. In the early days, I'd call it the early 2000s, right? Where no one was really talking about potential risks or anything with the way that the mainstream medicine model was doing healthcare for women and children at that point. And, you started hearing a little bit here and there about how, parents were questioning what was happening, and there were small groups of people gathering to see, what did you do? What happened? Like, how did you get to where you are? And slowly that number of people started to grow. And so it was interesting for myself as a practicing doctor originally, when I would have patients come to see me. It was parents, right, where they were concerned, and it would be very just kind of hush hush, like they didn't want anybody to know that they were thinking about not vaccinating their child. And it tended to be European families. And so, we would talk about what were the risks and benefits of either going through with it or not, and if there was possibly any kind of modification. But of course, in the allopathic or mainstream model, it's everything. It's not pick and choose what you want. And so they were trying to figure out, how do they do that? And then over the years, I had more and more and more families coming to me, more parents asking questions, more people who wanted to know. So that just kind of grew. And on my end, I wanted to be able to reach more people, more families who had these questions that maybe I wouldn't ever meet in person, and so that their questions could be answered. And that was where the book came out of, because it was never really meant to be something that was either promoting vaccinating or not vaccinating children, but really to understand that there were risks involved in any of the possible scenarios, right? So how could we mitigate those risks? And that was really kind of the perspective behind how the book came into being. And so I've still worked with families, with children, and my work just kind of expanded over time, where I've ended up working with not just moms and kids, but dads and grandmas and grandpas and the whole family. So it's just kind of blossomed there. But still, my focus has always been working with children and women. So yeah, I've done some teaching for close to 2 decades at this point at the university and graduate level. So that's been really fun. And yeah, just staying really, really active, because I was thinking that people would get healthier, that there would be changes in our environment, that things would get, cleaner somehow. And the opposite has happened, right? We're seeing higher rates of toxins in the air, in the food, in the water, right? So staying really healthy is now a proactive part of life to prevent disease. So that's a lot of what I work with families nowadays, is just how to keep themselves strong, how to keep their immune system strong.
Exactly. Yeah. How to stay as healthy as we can in the environment that we're given, right?
Yeah. Yeah.
Because unfortunately, you can't eliminate all of the toxins, all the glyphosates, and
yeah. Yeah, so like it was just funny. I saw this meme the other day where it was, somebody trying to get ahead of all the different chemicals from different sources, and it's like they're just barely, staying ahead of the curve. And it was really, just to look at kind of the medical information or scientific information that's available. I want to say it was back in 2004, where there was an article that was released by the Environmental Working Group. And at that point, they found that there were close to 300 chemicals in newborn cord blood. And, that was in 2004. So we're 20 years later. So, I looked for some new data and I haven't found any that does that kind of total body burden for children, for newborns. And I've seen it in parts per million for heavy metals like lead or mercury, but I haven't seen it just as a total number. So I'm just, I'm curious to see what are we looking at, because I keep up with this, and I've ended up working with women with fertility issues, for example, and we keep seeing these environmental chemical endocrine disruptors coming up in their blood work. So, there's a lot there to unpack.
Oh yeah, absolutely. And as you said, education and just awareness is key.
Mm-hmm.
Yeah, and it's funny, my mom and my husband's mom were really good about keeping our health records when we were growing up. And I ran across both of our vaccine records. And I joke with my mom, but she's like, you were vaccinated and you turned out okay. I said, well, Mom, it was a different world in the 80s. I mean, I was 82.
Yeah.
And so I looked at our records, and I think maybe I had maybe 8 vaccines versus now, which I think is in the 20s.
Oh, well, by the time a child is 6 months old, at that point, they would have gotten about, 24 vaccines, give or take, right, at 6 months. And so, bump that up to a year, they're closer to 30, 36, give or take. By the time they're around 5, it's somewhere in the ballpark of about 50 vaccines, give or take, right? So it's just the number of vaccines that children are getting today versus what they got, 30, 40 years ago. I mean, in the 70s, children maybe got 6 or 8.
Yeah.
It's nothing like what it is today.
It's wild.
Yeah.
And I appreciate your perspective with educating, let them making their own choices. Mm-hmm. I know in my practice, if a patient wants to vaccinate, I always recommend a European delayed schedule. Mm-hmm. What are some other recommendations if a family does want to vaccinate that you recommend to kind of mitigate any possible side effects or consequences?
Yeah, so, one of the things that I have seen pediatricians being more open to is having more, for example, a delayed, maybe doing a couple 1 month and then waiting, you basically doing one or two every month, right? So that they're just spreading them out. And that seems to give the immune system a chance to actually do or give the body the response that we want, right? Like if we're going to be vaccinating children, then there's the protection that we're looking for. And we see that actual immune response in a very organized fashion working, right? So that ends up giving them a chance to build up their immunity in the way that we have, that we've seen, right, through all the studies. Another, possibility in that first year of life, children they have higher levels of Th2 receptors. So that makes them more susceptible to things like allergies and eczema. And when we give vaccines at those early ages, the immune system that they already have is what gets prompted. And so this is part of why we end up seeing higher rates of allergies or eczema, because that which they already have is stimulated. So after a year is when they build up their Th1, and Th1 is what helps them fight more of bacteria, things that they would normally come into contact with once they're, crawling, they're getting around, they're now able to kind of build up that part of their immune system. So it's partly based on the normal developmental factors that children would be exposed to in their lives, right? So if we're following that model, then we've got children that can basically mimic what they would be doing in nature. So, kind of in an ideal world, we wouldn't even start vaccinating until they're older than a year or two. Back in the 70s, children weren't vaccinated before they were 2 years old.
Wow.
So this common practice today of vaccinating within the first 24 hours, that was not something that we saw in previous decades. So we could delay them, but then there's the factor of, yes, they are more susceptible to things like pertussis, right, whooping cough, which is more prevalent and has more potentially damaging effects if they're less than 6 months old. So we end up seeing that children with siblings, right? So babies, newborns with siblings are more likely to get exposed to things that their older siblings are bringing into the home. So we have a little bit more of leeway, I'd call it, with single children or first children, right, where they can go through that normal developmental process. But then with subsequent children with a bigger family, everybody's getting exposed to things that everyone is being a part of in different communities in whatever their lives might be, in different either daycares or in play groups, or wherever they're going, or preschool or things like that. So they're coming into contact, but that's also part of their normal developmental system. So this is, we're through the activities that we would be doing in everyday life, these would be the things that would normally prompt immune development, right? And recognition of what is innate to the body and what's an external pathogen, and helping them develop that process of recognition and normal responses. So it's important to get kids, to be out, to be in nature, to be with other children. There was this great study that was, it was published by the New York Times, and it was looking at it was children who had, or families who had dogs in the home, and that through the dogs just going around and smelling around the little bushes and things, that they would end up getting different bacteria on their whiskers or on their snouts. And so children who would then kiss the dog, right, they would get exposed to these. They would be spores, or it's not anything we would ever see, but that would give them a little bit of an immune boost. And the same for the dogs that would then roll around in the grass, and children who would pet the dogs or kiss the dog on their back or something, that we would see again, that they would get that enhanced immune function.
Yeah, I love that study. I've seen that.
So it's great, right? This is part of, for saying, what is it that families can do if they want to vaccinate? Well, expose them to nature, right? Help them get that natural immunity going, help them be exposed to a wider group of just normal organisms that are part of life. Keeping them in very sterile environments is actually, we're finding, detrimental to them. Having them in homes that don't have a speck of dust on the floor, that ends up creating higher cases of allergies for the children. So it's okay to let them get dirty, right? It's okay to spend some time playing outdoors and just being involved in the world, right? In the natural world, and spending some time in the garden, in the backyard, these kinds of things. And so there's a lot that we could do to prepare the body. And then for, some of the common reactions that we might see, for example, child going in to get an injection, there could potentially be some swelling, some redness at the site of the injection. And there are homeopathic remedies that families might choose to use to help prevent any kind of reaction just to the injection itself. And so that would be one option. Or also to help the body's natural immune responses, we could provide some more vitamin C, vitamin D, right? Vitamin C works well if it's before and after the actual vaccine, right? But vitamin D is one that has to build up over time. So we need to give that a couple of months in a row to really build up those levels. However, with babies, there are some companies that sell like vitamin D drops, but it's also really helpful for moms if they're breastfeeding to give those, for them to take vitamin D so that they're giving it through their breast milk, basically.
Yeah, I agree. I think it's important to ask, when you're pregnant, if possible, to ask for that to be drawn, because a lot of times they don't preventatively draw it. That way you know where you stand.
Yeah, that would be really helpful. I think there's so many factors here, right? Because then if a mother is breastfeeding or not, then you've got, again, different risk factors based on what kind of immunity a baby is getting, right? So a baby that's breastfeeding is going to get many of the immune factors that the mom gets. We don't know exactly how much or what, but we know that it is there, right? And it's going to vary from woman to woman as well. Just like you said, some women may have higher or lower levels of vitamin D, right? But it was an interesting case of it was a family that I was working with, and they had 5 children, and everybody got whooping cough, right? All the kids, I think they were 2, 5, 8, and 10. So those were the older kids. And then there was a baby that was just about 8 months. And so everybody, including mom and dad, everybody got whooping cough except for the baby who was breastfeeding. So we know that there was some kind of immune, antibodies that the mother must have been creating that was then passed on to the baby.
That's awesome.
So, yeah. These are things that oftentimes we don't see them, right? Most people wouldn't see them unless they're working with people who have larger families, and then we can start to see how these things actually work in real life. But lots of people just have maybe one. It's interesting to me looking at like families that are more urban based, right? So urban families don't tend to have a lot of children. Families that live in the countryside, and I worked with lots of families living in the country, they tend to have more children, and we would see that kind of reaction in the children more often than not, actually. So yeah. But there's probably other factors in there also, right? We saw there was another study that was done on Amish children that looked at how the children who were working with the farm animals, who were actually like milking the cows, for example, that those children had lower rates of allergies and asthma than the children who didn't. So, but in that case, they were actually comparing the Amish children to children who never spent time on a farm.
Okay.
So completely different demographics, right?
Right. Yeah, just like you said, getting out in nature, what we're meant to be doing, right?
Yeah.
Yep.
There's all kinds of things out there. There's a book, I can't remember the title now, but it was looking at, it's a whole concept of nature deficit disorder, right? Where children aren't being exposed to nature enough, and that's part of what's leading to a lot of the developmental problems, some of the mental health problems that we're seeing with children. So there's long-term benefits that we get from seeing children exposed to nature from the time that they're babies, right? Like actually letting them get out and crawl on the grass, but at the same time, we have to also consider that grass can have pesticides on it, right? So we've got to be able to get them in a place that is that's cleaner, right? And that's the tricky part.
Yeah, absolutely.
Figuring out where. So, I think that's part of us being aware of our kind of environment that we live in. What kind of city do we live in? If people are living in areas where there's more spraying, like on golf courses, no, like this is not a place to have a baby like crawling around, right?
That turf, none of that.
Exactly. That's not the appropriate place. But maybe if it's somebody who has a big backyard and they don't spray and their neighbors don't spray, right? That's the other issue there also. So then, this ends up becoming a community effort of keeping our neighborhoods clean for our children.
I love that.
Yeah. So yeah, there's a lot that parents can do on their own. There's a lot that then we can reach out to our community for support in.
Well, I have to ask, because a lot of my listeners have messaged me, what are your thoughts with either ADD, ADHD, autism with vaccines? For me as a practitioner, I don't think there's one trigger, but I think there's, like we've talked, a multitude of, nature deficit, toxins, vaccines, the whole combo. What are your thoughts on that topic?
Yeah, same, that we can't pinpoint just vaccines, right? That's not the whole picture, right? Just yesterday I was listening to Zach Bush, who was talking about like the glyphosate, for example, that there's also a correlation there with the increase in glyphosate over the last 40, 50 years, right? That we've also seen a rise in autism spectrum disorders, right? So yes, there's that toxin component. There's children spending more time indoors, not getting exposed to the outside. And yes, there are many, many children or families who would say that their child was normal prior to being vaccinated. And that they saw a very distinctive shift before and after. And the one that had the highest number of this kind of shift, where families felt like they saw their child developing normally up until it was the MMR, right? And when they got that vaccine, that was when they saw the biggest shift. And so, so I don't know, maybe something to kind of look for, is there particular risk factors? There's measles, for example, the cases of it will rise and fall. It has a particular life cycle, we'll say, where we'll have maybe 5 years where levels are low and then it just kind of spikes up. And then those levels just kind of naturally kind of come down in the environment for children. And so measles can have long-term problems, but we also see in generations previous, so people who would have been, say, growing up, if they would have been children in the 50s or 60s, many of them they didn't have these vaccines, right? And so children would just get measles. That was part of their normal development as children. They would also get mumps, right? The MMR is for measles, mumps, and rubella. And again, there are potential long-term consequences with mumps, especially for boys, right? And potentially they could become sterile. So this is something that is of concern. And then rubella, which was added in there, and that was one that was given for mothers who might be pregnant and might have a child who gets rubella. And that could potentially lead to the mother having a stillborn. And so they added the rubella onto the MMR to minimize that risk. What we've seen is that the rates of, rubella in the last 20 years, we've maybe had 20 cases in the United States. Now I should say that was from say 2000 to 2020. So since then, the numbers, right, in those pandemic years, the numbers of tracking of different contagious illnesses for children, we didn't track those quite as much. A lot of focus was on COVID. So there's more, research that we'll have to catch up with. And then mumps was one that became much more prevalent within college age kids, right? People living in close communities together. So it was college age kids. It wasn't children. It wasn't babies that were getting mumps. It was college kids, right? And then measles tends to be children who are somewhere between like 6, 7, 8, 10, somewhere in there. So then, again, we don't tend to see those in those younger children. And so that's where we have to look at, what are the risk factors? And oftentimes, the way doctors explain it is it's better to have them build up their immunity before they actually get into these types of environments where they may get some kind of exposure to these infections. And so then that would be the reason to give it earlier. But I'm looking at the families I've worked with where it was one of those really big night and day shifts before and after the vaccine. And, would it be safer for us to maybe wait?
Sure.
Or if we're seeing that the rates of autism is higher in boys, I think that we need to have more studies done. Like, why is it that boys are more susceptible to it? What would happen? Are there particular people that are affected more so? Because we did see it more in the African American race. And so in those particular boys, well, then what is it? Why is it that they are more so affected? And at this point, the most recent data I've seen is that 1 in 25 children today will get autism, compared to in the 70s, it was 1 in 5,000. I mean, that is just extraordinary, right? Like an astounding difference. And so I think we really should give these children a chance. We should be doing the research, because maybe there's something genetic. Maybe they are. Maybe we have children that have genetic mutations where they're not able to process different things as easily. So to give an example, we've seen that the MTHFR gene mutation, right, is one that has been, again, correlated with some of these children. Well, then maybe children who have that particular gene mutation, then maybe they're not candidates for a particular vaccine. Maybe we have to work with them in different ways. And we've always had a population of children who, for whatever various reasons, couldn't get vaccinated. They might have been born immune compromised, or had some other kind of congenital condition where they weren't able to get vaccinated. And so we would make provisions for those children. And so maybe today we have another group. I don't know, we're not doing those studies, and I think we should be, because that would be responsible medicine.
Yeah, that's a great point. I've seen studies that show children with autism, 98% of them have that MTHFR deficiency. Crazy. So why are we not genetically testing before we vaccinate?
Yeah. There are changes that we can implement in how we're working with children that would be much more healthful for a longer span of time, right? So I think that that's on the researchers, that's on the scientists, that's on medical doctors, that's on policy regulators, right? To be able to say, okay, yes, let's do this for the sake of our children and for the sake of our community, right, at large. Just this morning I was seeing an article about, the epidemic of infertility is here, right? And that I've worked with families with young couples in their 20s who can't have children. And, in their 20s, this is when human beings are the most fertile and the most should be the most easy time to reproduce, and they're not able to. So, I think we have to be asking these questions and starting to do the research for our long-term well-being.
Absolutely. Yeah. That's one thing I love, is going to the research and having that clear up any questions.
Yeah. Right. Like to a certain extent, we have research that can answer questions, but then there's a whole lot of research that we still need to do.
Right.
That we still need to kind of consider, why are these things happening, or how can we help our children more so? How can we make informed decisions? Because maybe there's a better way. For example, if really vaccinating children, if that's really the better way, then let's get that Let's get that research. This is one of those areas where, it's a big point of contention that there was supposed to be post-market surveillance on all of that vaccines, right? They were federally mandated in the US to have that post-market surveillance to see were there problems or not with the vaccine after it was released and it was used. And those studies weren't done, right? So we should be doing that. We should be looking at those things. And some countries have looked at it and they have said, we're seeing higher rates of adverse effects. And so they're stopping,
Sure.
like Japan stopped giving the HPV vaccine, for example, because they were like, wait a second, something's happening here. And so that was a governmental decision to say, let's study this further. And there are other countries, I know Italy was doing more studies, and France and Ireland, right? Like there are countries that are saying something's happening. So let's look into this further, so that we can have really clear information about what's happening. So there's a lot, and also maybe for children, it's actually better to be breastfed, throughout that first year, right, of life. And maybe let's vaccinate after a year. Maybe that's actually when we get a better response. And let's get that information again, so that we're doing things that make sense for people. What's the tricky part, right? Like as a naturopathic doctor, I would work with people in a very individualized way. But what the mainstream medical model is doing is looking at people as a whole, right? They're looking at public health. And so we have different risk factors for the public at large versus the individual. So they're two completely different paradigms of how we work, right? As how do we live together? How do we support each other? And so then for the families who say, well, I don't want to vaccinate, that is a viable option. But if you're choosing not to vaccinate, it doesn't mean that you're choosing to not do anything at all. It means that you're choosing to make fresh food, that you're choosing to, prepare things that are organic, that you're choosing to not give your child cookies and chips and colored foods, and that you're really choosing to be very proactive in the care of those children. So it takes more time, it takes more effort, it takes more energy to do that. And I've worked with many families who have done that. For moms, they have to prepare all the food ahead of time. And if they're going to breastfeed, then they've got to watch their nutrition as well. And they can't just, eat whatever. They've really got to be mindful of what they're consuming, making sure they're having the vegetables, the non-inflammatory foods, the things that are good for them and good for the babies at different stages of their own development also. So then it just becomes more about, well, what actions do you want to take? Because in reality, really is easier to just get an injection and not think about anything else, right? But maybe there are children who genetically can handle the injections, right? Because maybe they've got those genes that help them process through whatever potential adverse effects are. Like they don't get that because they can metabolize whatever are the components of the vaccines themselves. So, these are the things that we're having to work with. So it's not an easy decision. It's not yes, all one way or all the other. There's a lot there to kind of look at. And even for families who do choose to vaccinate, we still want to have the optimal immune response. So it still means give them the supplements, right? Like give them the vitamin C, give them the healthy food. You're not like, it doesn't mean that you absolutely disregard everything, because they still need the nutrition, right? They still need those vital nutrients to be able to grow and develop and have their brain develop normally. And also there was another interesting study that showed that there were higher rates of SIDS connected to off-gassing from some of the fire retardant chemicals that were being used on the mattresses for babies, right? And so, well, then maybe you have to invest in a mattress that doesn't have fire retardants on it, right? So these are the kinds of decisions that that we're looking at. And to a certain extent, there's also the financial aspects in here, because it also does mean that we have to put more money into it. And so we're having to make different decisions. And, ideally people do have the resources to be able to buy fire retardant free mattresses, right? Which are more costly, right? But and again, then that's the bigger question, is why are they more costly? Like it should not cost you that much more money to provide a safe environment for your baby, right?
Just like, why is organic food so expensive?
Exactly. Like they're using less chemicals. I guess they've got more manpower, right? They've got to put more people on the farms to care for things, and they have to be more thoughtful, and they have to plan, and all of that takes time.
Yeah. Things that were normal in culture in the 40s and 30s is now organic and clean and holistic. It's a weird paradigm shift.
Yeah, right. So these are the kinds of questions, right, that it's kind of like you have to take this like a lens and look at your whole entire life, and like, what do you do? Are you like with the situation with SIDS, kids who had somebody who smoked in the household also had higher rates of SIDS. So, well, then if there's somebody in the house that's smoking, can they quit? Can they quit smoking, right? So that's also part of the picture, right? These are all the things that we're thinking about. And so when we start talking about how do we keep our babies, our children healthy, then we've got to really open up the lens and look at what is the lifestyle that these people, that the families are living in, and are they willing to make those changes for the sake of having really healthy children.
Exactly.
And those are not easy. They're not easy decisions. They're not easy discussions. They're not easy things to change, right? Not easy behaviors to change. So we really are asking people to do a lot if they're choosing to then, on top of changing all of their lifestyle habits, to then not vaccinate. Then you've got to really, there's so much to do there. And that's where educating people on what does it mean? What does it mean to have a healthy child, a healthy family, a healthy household? Because that's what we need to really keep up in our lives. And really, truly, the difficult part is in the beginning, right? Is when they're first starting, and then you get used to it, and then that becomes normal, and then it's just kind of, health is the side effect of a healthy lifestyle. But it's those initial changes that can be really challenging.
Exactly. Once you're in it for a little bit, it does become second nature. But yeah.
So it's, this is where, in the book, for example, I talked about what were risks and benefits, what had we seen in terms of how many children might have been affected with particular vaccines or not, and which ones were really maybe this is one that you really do want to think about having, because maybe there's an outbreak, or maybe they're going to be in an area where this is more prevalent, or for example with the polio vaccine, in some countries they still use the live virus as part of the vaccine itself. So if they're going to if the family is going to be traveling to those places where the live virus vaccine is still used, then that might be something to consider. Maybe here in the US we use the killed virus to make the vaccine, so we don't have the same risk factors, because we saw in the US that more children were actually getting polio from the live virus vaccine, and so we reformulated it and we didn't see those same problems, right? So those are the kinds of things that those are risk management decisions that families have to make, and even in cases where if the family, if the parents were really scared about a particular condition, right? If their kind of mental emotional stress was so high about, I don't want my child to get this condition, whatever it is, and if there's a vaccine for it, if that gives them peace of mind, at the end of the day, they are going to be a healthier family overall. Because that peace of mind that that particular vaccine gave them, they can do all the supportive measures around that,
Sure.
right? So that then, ideally we would get the optimal response from it. But there's risk involved with anything that we do, right? And this is part of the National Childhood Vaccine Act, right? I always forget the full name, but it was the act that was passed in 1986, right? And so part of what they stated in there is that vaccines are unavoidably unsafe, right? So we know that, right? Like we know that there's inherent risk in those vaccines, and that was part of what allowed that legislation to pass. Like we know that, but based on knowing that, what can we do to minimize those risks? And so that's where the good food, the supplements, the healthy air, the time outdoors, everything that we can do, probiotics, right? All those things really help to minimize those potential adverse effects.
Exactly. And you cover all of that in your book, right?
Yeah, all of it. I mean, I loved it. Like we ended up doing research between myself and the co-author. We had a time. We had about 200 years of data from before vaccines were ever introduced, right, to kind of what we've done today. And so we compiled all that information from different texts. We have every chapter has a long list of references so that people can go and look at those references themselves if they want to know more. But so from a lot of medical textbooks of how we treated illnesses in the past, like in the 1800s and the 1900s, how did we work with these particular illnesses? What were the treatments? And so we gave all of those in terms of, well, what were the herbs or the homeopathics or the specific vitamins or nutrients, or what were the hydrotherapy treatments, or was there any physical therapy or essential oils that they could use? And we gave recipes in there as well so that you would know how to make them, and instructions for any at-home treatments that would be safe to do at home. That was the biggest thing that we really focused on, was how do we keep, like, if we're going to be working with our kids, and obviously mothers, fathers, that you're going to be the first line of doing something on the spot. So we helped parents kind of guide them, like, is this something that you can safely treat at home? Or, you know what, you're seeing these particular things, you've got to go in to see a medical provider as soon as possible.
Sure.
So we helped, we did our best to try to help parents make those decisions about, can I safely work with this, or do I need to actually get some further medical care for this particular issue that they're having. So just to be able to recognize the signs of something that's, easily treated at home, or something that could potentially be dangerous. So you've got to get that advanced care.
Perfect.
So it's all there, all the references, everything to really help it be just a household staple. And I've been so happy that this book has been available to parents, and people have been buying it all over the world, really, to have it. Like, I even have people who don't speak English, and they're like, I still want the book, and they figure out how to do the translation on their own.
Oh, that's awesome. Yeah, I actually suggested it to a patient. She's a grandmother, and her son is choosing to not vaccinate. And so she says she just wanted a good reference, some information on it, because she's a nurse and this is a whole new ballpark for her.
Yeah.
And so, yeah, from her feedback, she's enjoying it.
Well, the book is available in Spanish, so that's at vitalhealthpublishing.com. So they could get it there. And so we have it in English and Spanish at this point. And we were hoping to translate it into many different languages. And then the pandemic really changed kind of the landscape of how willing people are to talk about this. And so it's available in English and Spanish, but it's there. And I've got lots of families who keep it as kind of a reference for for the lifespan, because it's really something that can be used for, babies, newborns, all the way through until they're 18, right? So, yeah. So, yeah, just makes me really happy to see that I've been able to actually achieve that goal of wanting to help families that maybe I never met. And I've always said, anybody who's interested and wants to reach out, probably the easiest way to reach me at this point is on Instagram, because I'm there and I'm happy. And parents they reach out, and I'm so glad that they do, because I guess maybe this is part of my life mission, is to help these families and help them feel confident in the decisions that they're making, because there's a lot of I think there's just a lot of gaps in information. And
Absolutely. And depending on where they're at, they might have somebody like you in their area, but most of the time they don't. So that's a great connection that they can have with you.
Yeah. So I'm available for any parents who have questions.
Awesome. Well, thank you so much for taking the time today. This was just a pleasure. It was great learning all of your knowledge and having you share. Perfect. We'll make sure to share your book and tag you. And then, yeah, if there's any questions, I'll send them your way. And thank you again so much for taking the time.
Oh, you're so welcome. It was my pleasure. Thanks for having me.
Yeah, thank you.